So, looking forward to the big holiday season, and well, with the holiday comes the new year, and the new year open enrollment. If you don't have health insurance, by all means, with this administration, there's an opportunity to sign up. And look, if we could get Build Back Better passed, if we can get some sane legislation pushed through, maybe we could make it even more affordable and make sure that more people get covered. There's so much we could be doing. And here to share some thoughts on that, I've asked Laura Packard to come talk with us. Laura is a stage 4 cancer survivor, healthcare advocate, and host of the weekly ACT TV show, Health Talk. Laura, thanks for taking time for us.
Thanks for having me.
So let's start with the open enrollment period, because I think I got it wrong. Open enrollment goes until when? January 15th?
Yes, for most states, it runs until January 15th. So you may have heard December 15th as a deadline. That's the old deadline under the Trump administration. You still needed to have signed up to get coverage January 1st. But if you haven't signed up yet, it is not too late. You have until January 15th, and then your coverage will start in probably February.
No, and I highly suggest if you don't have insurance, get it, because like you said, a lot of states are subsidizing it. What about the states that don't? I mean, there are a number of Republican states that haven't expanded Medicaid. How does that work?
That's why it's so important to get Build Back Better through, because working class people in states like Florida and Georgia and North Carolina can't get health care because they don't make enough money to get Affordable Care Act plans, but yet they can't get Medicaid either. So since their Republican legislators refuse to do their job, we need Congress to do its job and make sure that everybody can get health care.
Which takes us into the Build Back Better plan, which some of in the Build Back Better plan would actually help assist the Affordable Care Act and actually assist in making it a little bit more affordable. Am I getting that right?
Yeah, there's several pieces, healthcare pieces in Build Back Better. One of those pieces fills the Medicaid gap so that people in those states, working class families, can get plans that just cost $0. And also, it makes Affordable Care Act plans for everybody more affordable through 2025.
What do you say to the people who go, these plans are high deductible plans that, they're not really great. I mean, and look, we should have been making these better the last 10 years. And because of Republican obstruction, we haven't done the tweaking and the things that need to be done. But what do you say to the folks that, it's not that great?
Well, you should go back and check, because with the American Rescue Plan earlier this year, plans did get more affordable than ever, but those subsidies end next year unless Congress acts. So go to healthcare.gov. Even if in the past you couldn't afford something, check it out. But also, the very cheapest plans might not be the best plans for your situation. So take a look at all the plans available and figure out, if you have an idea of how much medical coverage you're going to need. And also, you can get free help. If you go to healthcare.gov, you can find somebody local to talk you through it if you need help.
Yeah, that's one of those things that drives me crazy, though, Laura. You only pay for what you need. No, how about you just pay for I get covered? Because I don't know what's going to happen in the next year, and I shouldn't be having to roll the dice to go. Maybe I get sick, maybe I don't. Let's risk it. I've always been of the mindset of let's have the best possible plans we can get for everyone. And make sure that if I get sick, I'm not going to go broke. If I get sick, I don't have to file bankruptcy. If I get sick, I don't have to argue with insurance companies. I don't have to worry about stealing from the kids' piggy banks. Or am I asking? I think I am. I'm asking for too much.
Well, I mean, it seems like every other industrialized country has figured this out better than we have. The Affordable Care Act was a good step forward, but it didn't get us all the way there.
Yeah, and lots more to do. And how much would the Build Back Better Act, how much would that do? Now, look, I think we both agree, probably not happening this year. And where we might disagree is I don't think it's ever going to happen. But, it's one of those things we got to keep working and pushing for. But sadly, I'm looking at Manchin and I'm looking at some of the things coming out. It doesn't look good, does it?
Well, I mean, it was a blow. Schumer was saying that we would have a vote by Christmas, and Manchin's just not there yet. So, I mean, right now, it's up in the air whether we get Build Back Better, and also it's up in the air whether we get voting reform. And so that's why it's so important to contact your senators, make sure that they are hearing from you, that they know this is not going away. You are not going away. You are going to hold them accountable with how they vote.
Yeah, I mean, I look at the Affordable Care Act and what it did, and I look at someone like you, you're a stage 4 cancer survivor. Before that, you'd be uninsurable. Before the
Oh,
passage
yeah.
of the ACA, you'd be uninsurable. And look, going through this pandemic, anybody who's had COVID, you would be almost uninsurable because of pre-existing conditions. And these are the kind of things that I don't think we talk enough about on the successes, and it's easy to tear apart. And look, I was not a huge ACA fan, but I do see it as a step forward and move in the right direction. But I'm not going to tear it apart because there's some things I don't like about it.
Right. Well, I mean, also tearing it apart when there isn't a replacement. This is exactly what the Republicans tried to do. Is they tried to dismantle the Affordable Care Act, and they had nothing to replace it. And that means millions of Americans like me would lose their health insurance, and many of us with pre-existing conditions were uninsurable. So, I mean, you can't dismantle something and leave people out in the cold without having some sort of replacement. And that's the piece that the Republicans never figured out.
Listen to the Rick Smith Show. We're here with Laura Packard, stage 4 cancer survivor, healthcare advocate, and host of the weekly ACT TV program, Health Talk. ActTV.com, right?
Yes. Well, act.tv. Sorry.
Oh, ACT.TV. We'll make sure we get links out on social media how people can take a look at your show. When does that air?
My show airs on Mondays at 4 o'clock Eastern. It's Care Talk, so like car talk, but except for your healthcare. And we're answering people's healthcare questions. So exactly the kinds of things that we talked about tonight. If you're not sure what is the best thing to do for your situation, if you need access to care and you can't afford it, or if you're not sure whether to go on, how to apply for Medicare or which plans. So that kind of thing, we are answering your questions every Monday for free.
That's fantastic. What do you think of the Medicare Advantage program? I had a bunch of
Well,
listeners who were in New York City just beyond themselves that the city has moved a lot of their retirees to this Advantage plan from what they were promised, and they are flipping mad.
Well, in some cases, it's a good fit. Like if you are not, if you don't move, if you don't travel, if your doctors are in their narrow networks, then the fact that they often roll in, vision and dental and hearing, the things that traditional Medicare doesn't cover right now. So it can be a good fit if you are not mobile. But like if I was looking at a plan, it would be terrible for me because I travel so much. So traditional Medicare, where you can see a doctor pretty much anywhere, is a much better fit.
Yeah. Um, it's one of those things I look at. You brought up the vision and the dental. I'm still miffed. I don't know if miffed's the right word. Downright angry. I want to use a more vulgar word, but terrestrial radio doesn't allow me to do that. I'm really ticked off that they pulled out the vision, the dental, and I guess they left in the hearing, right? In a bill that probably isn't going to pass anyway. Uh, how come we can't get these things that should have been done, decades ago?
Well, I can tell you at least for the dental piece is the dentists didn't like it. The dentists were rising up against it because they thought that it would mean less money for them. But also the insurance companies thought that there would be fewer people using Medicare Advantage if traditional Medicare became a better deal. So traditional insurance companies were also out in force against it. So I think that's one of the reasons why, even though this is incredibly popular and it's so obvious that we should be doing this, there was so much money against it.
Yeah, well, the moneyed interest seem to always get what they want, don't they?
Well, we shall see. I am more optimistic than you are because I do not think that they are done yet on Build Back Better, but we'll see what happens in January.
How do you see that playing out then? If not now, because I think you only have till March. I think after March, if you don't get it done by March, it's done because everything then ramps into election time, and it's over. You've got to have something. I don't know how they can go into election season by not passing it and having something in hand to go, hey, look what we did. But I just don't see Manchin. I don't see you. You use the phrase that I keep hearing from people. He hasn't come around yet. I don't know that he does because every time we meet one of his demands, like ragweed, something else pops up. There's always something else. And I just see him continuing that.
Well, I think that this holiday season, Joe Manchin and Kirsten Sinema are going to hear a lot from their constituents. They're going to have to listen to their own hearts and realize, do they really want to sink Joe Biden's presidency and hand over the Senate to Republicans? Because if there is nothing for Democrats to run on, that is the future that they are putting into action. And Kirsten Sinema, at least, will not be reelected. The polling already shows that Democrats in Arizona have just about had it.
Yeah, well, I was never a big fan of Senator Dipsy Do, especially after that minimum wage, whatever that dance was she did with the funny skirt on. But I guess we are where we are. On the COVID front, I'm looking at New York. I'm looking at Ohio calling out the National Guard to work in the hospitals that are already slammed, and we haven't hit a real surge yet. I know one expert has said we're headed for a viral blizzard. Things are going to get bad. Curious what you're hearing.
Well, the same, and that there isn't really enough news out yet about this new variant Omicron to know whether it is more severe than Delta and the other things. But we do know, so far at least, that it is spreading faster, that it is more transmissible. So whether or not it's more likely to put somebody in the hospital, if there's just so much more out of it and so many more people that get sick, especially people that haven't been vaccinated, then we're going to flood our hospitals. And we're already seeing that.
Yeah, what do you say to the people who? And I've gotten a lot of people who say, "Well, we shouldn't put them in the hospital. If you didn't get vaccinated, you're on your own." You agree with any of that?
Well, I think that doctors and hospitals are going to have to make some hard choices, because when you only have so many beds and you have more people than have those beds, they're going to have to look at who they think is going to have a better outcome if they get treated. And we never should have been in this place. And if you have not been vaccinated yet, go get vaccinated so that you do not have to fight for the last bed in your local hospital.
Yeah, I mean, I always think about the Winston Churchill quote, where he said, "Americans always do the right thing after doing everything else first." And we seem to be in that doing everything else first stage right now. You look at some of these mother groups that are fighting against masks in school, and you listen to some of these politicians like Marsha Blackburn, who, we're going to be singing on Christmas, and I don't care what Dr. Fauci says, and this kind of ridiculous rhetoric that somehow we're saying you can't enjoy your life. We're just saying no, you don't get to make all of us sick by being stupid.
Yeah, I prefer the freedom of not being intubulated.
I think I agree with that. I think I'm going to agree with that. I also have the right to not be sick and dead. So we are where we are. Where do you see this going, though? Do you see a mass explosion? Because I got a listener who sends me he does modeling, and this is his thing, and he says, come the end of February, things are going to get really bad.
Well, I'm not a doctor, but it seems like the more people that travel and are in large crowds this holiday season, that we're going to see another spike in January. So the people that are acting like COVID is over, well, COVID is not over with you.
Yeah, well, again, I said at the beginning, it's like deja vu all over again. The NFL is moving some of their games. The NBA's got some problems. There are a lot of people going, we're changing things again. And when you see the moneyed interests start making these extreme moves, uh-oh. Now, I don't believe there's ever going to be another shutdown. I don't think we're going to see that. I don't think it will matter because there would probably be a revolt. But we're gonna have rough days ahead, I think.
Yeah, well, I mean, the thing that's so frustrating is that it is not a hardship to wear a mask. Get your shots, wear a mask.
Yeah, but
it doesn't have to be this political thing.
Yeah, I'm with you, but I can see some people who don't brush their teeth not wanting to wear a mask. I can see that. Or there's the guy from Florida. I want to get your thoughts on this. The guy from Florida who wanted to fly, I guess United has banned him completely. He evidently was wearing a thong as a mask. I'm not actually opposed to that. As long as it was covering his nose and his mouth, and doing what a mask is supposed to do, cutting down on the particles, I actually don't care.
Yeah, I mean, I don't know that a thong is going to really stop a lot of transmission, but I guess, I mean, I would prefer that it were granny panties, but whatever gets it done.
And that's how absurd all of this has become. I mean, this guy got attention, was actually on the local news, and played the "I'm a Patriot." And no, he played the "I'm Rosa Parks" because he's wearing a thong on his face instead of wearing a mask, and they threw him off. So he is Rosa Parks. That's how ridiculous things have gotten.
Yeah, I'm pretty sure that Rosa Parks did not fight for your right to wear underwear on your face.
Now I would. You can wear underwear on your face if you want to. I don't care. Um, and as I said, I think it's okay as long as his mouth and his nose were covered and it was cutting down. Because ultimately, that's the point. We want to cut down on the particulates in the air because this is so contagious.
Right. And I mean, that's why I'm planning on traveling next week and I'm going to be wearing an N95 because I don't want anybody else's air getting in my face.
Yeah. Now, interestingly enough, one of the CEOs, and I think it's Spirit Air, who was against the mask because he believed that they had such good ventilation that they didn't need it. Evidently, he now has COVID.
Yeah, I mean, I think that if you are in a crowded place and you take your mask off, you don't know what the people around you have. And at least right now, it's quite likely at least one of them is contagious.
Yeah. Well, going to be an interesting holiday season. The malls are full of people not wearing masks, which I find very interesting. Um, it sets us up for a fun new year. But Laura, as always, I appreciate you taking a little time to talk with us. I hope folks will check out the ACT.TV program, Care Talk. Sorry, I got the wrong. I thought it was Health Talk. Care Talk on ACT TV, Mondays, 4 p.m. Eastern Time.
Yes.
All right, we'll make sure we get links out on social media how folks can take a look at that. Always great talking with you, Laura. I appreciate the time.
Thank you.
Good stuff as always. And look, as I said, it's going to be an interesting new year given the fact that everywhere I look, most people think we're past it. And even I have it in my head that, we're not going back to shutting down. We're not going back to the extreme measures. I just don't see it happening. I'd love to hear your thoughts, though. You can email me, Rick at thericksmithshow.com.